really dear and close to my heart is the subject of older age motherhood. It's something I wrote about when I was younger, and it's one of the things that really inspired me to go into this whole subject, because I think our whole society is changing and we're seeing so many more people, both men and women, choosing to start their families in their late 30s or early 40s. And having also practiced on labour ward myself, I've seen this real demographic change happen there, to the point that we now see 11 out of every 1,000 couples being over the age of 40 and conceiving at that time. So this is quite a significant number, and I think this number is only going to get bigger and bigger. So what do we mean by older age? Well, it's quite a pejorative term, and one that I don't really like to use a lot myself. However, essentially what we're referring to here is, as discriminating as it sounds, is when a patient is aged over around 38 years and above. So this is for both men and women, and that's because there are definite changes that occur within the eggs over this period of time. And if you go back to one of the other videos where I discussed where the eggs come from and how the process of ovulation occurs, you'll be reminded that we are born with a maximum number of eggs that we're ever going to have, and as we age and grow, so do our eggs. And essentially they also undergo the whole process of aging along with the rest of our bodies. So by the time you reach slightly older age, some of their DNA may have been affected. And it's one of the biggest reasons why we also see an increase in miscarriage rates in women who are over the age of 38, in particular over the age of 40. However, the men are not immune, and there are studies now showing that men over the age of 40 also undergo some changes in their sperm, and that the rate of miscarriage is also greater if the partner is over this particular age. So what are the things that you should be concerned about or pay more attention to if you're planning to be an old, or find yourself being an older age parent? Well, the first thing to say, and again I referred to it in a previous video, is that you shouldn't wait for a long period of time before you go and see your doctor. If you've been trying for 6 months or so, then I think it's time to go and see your GP, who can undertake some tests on both you and your partner. And some of these tests will be discussed in a separate video so that I can help you to understand what to expect from some of them, and we're going to go through both male and female tests. But I would say if you're a woman or a man who is experiencing any sort of chronic condition, so that's a condition that you've been diagnosed with for a period of time and you're aware, or may not be aware, that it may influence your fertility, then I think it's entirely correct to present even sooner to your doctor if you notice that you're having particular issues. And the chance of chronic conditions does rise the older you are. So for example, you'll have a much greater chance of having blood pressure problems or diabetic problems if you're slightly older. And it's one of the reasons why getting pregnant at a slightly older age could potentially be problematic. Now, if you're a woman who's fit and healthy, exercises regularly, watches what she eats, and is fine and well otherwise, then yes, you may sail through any pregnancy that occurs even in your 40s. But more commonly than not, some women may find themselves developing things such as preeclampsia, or problems with their blood pressure, or potential issues with the growth of their babies, or issues with their thyroid, for example. And so it's really important that you counsel and see your doctor on a really regular basis, and when you are pregnant, that you're under a consultant for all your obstetric input who can help to look after you. Going back to what I said earlier about miscarriage rate, it tends to rise quite steeply after the age of 40, and that's to do with the aging process that starts to affect the eggs, but also, as we're discovering more and more, the aging process that starts to affect the sperm. And this is why you may find yourself experiencing this particular condition, but not to get too alarmed by it, because it doesn't necessarily mean that you won't get pregnant. It just means that the chances of conceiving and carrying to term are going to be slightly less for you. I hope that's been helpful. One of the most important things I want to stress here is that if you are an older age woman or man wanting to conceive, it's really, really vital and important you go and see your GP, who can take a proper history and who can counsel you appropriately about when to seek help and what to do.